All right, hello everyone. My name is Michelle Bulterys. I'm a postdoctoral scholar at the University of Washington. I just finished my PhD last month from the same university, same program as Lin Xuan. Oh, thank you. Thank you. It's an honor to be here with such an inspiring group of people. So thanks for the invitation. Oh, sorry. So I'll be presenting on child neurodevelopment among children who are HIV-exposed and uninfected in Kenya. And it's very opportune that I get to follow Dr. Bovu's presentation. So there are an estimated 16 million children who are HEU globally. And over the last several years, I've been fortunate to work with Dr. Mary Mahey at UNAIDS to analyze the spectrum estimates of CHEU children globally. And here are two figures that we made this year using the latest 2023 figures. And the prevalence of children who are under 15 years old who are also CHEU exceeds 20% in many countries with high HIV burden. And that means that sometimes there are countries with over a quarter of children who are HIV exposed and uninfected. And Kenya alone is home to 1 million children who are HEU. So most studies have found poorer neurodevelopment among CHEU than their HIV unexposed counterparts. And this could be theorized to be related to many reasons, biologic mechanistic pathways, such as adverse birth outcomes, as well as household factors, such as food insecurity or intimate partner violence. And efavirenz exposure has also been associated with poorer neurodevelopmental outcomes among CHEU compared to other ART regimens. And there is limited data on dolutegravir. So our study was enrolling pregnant women during the period of expanded dolutegravir access, and this gave us a very unique opportunity to compare efavirenz and dolutegravir to child neurodevelopment among CHEU. So based on the current state of literature, the biologic mechanistic pathways for understanding child neurodevelopment among CHEU are much better understood than the social behavioral pathways on which very little data exists. So there's currently a very urgent need to understand and conduct rigorous multidisciplinary research to identify factors that could be modifiable or addressable through future interventions for these children. So this pushed us to try and fill these gaps within the HOPE study. So this study is led by Drs. Grace John Stewart, Dalton Wamalwa, and Irene Jaguna in Kenya, and is an ongoing multi-site prospective longitudinal cohort of 2,000 mother-infant pairs, 1,000 who are HIV-exposed uninfected, and 1,000 who are HIV unexposed uninfected. And we've conducted neurodevelopment assessments every 6 months, and this analysis looked at 1 year neurodevelopmental scores. So we conducted an exploratory analysis using mixed effects linear models, adjusting for confounders and clustering by site, as we had several sites across Nairobi and Western Kenya. For our overall outcome of 1 year neurodevelopment, we conducted the Malawi Developmental Assessment Tool, otherwise known as MDAT, which is a validated, culturally appropriate tool that uses locally sourced items from sub-Saharan Africa to assess 4 domains, so social, language, fine motor, and gross motor. So I wanted to look at 3 different buckets of cofactors of neurodevelopment. So first, I wanted to compare neurodevelopment at 1 year between CHEU and CHUU children. Second, I wanted to test for cofactors of neurodevelopment among all children, adjusting for HIV exposure status. And then lastly, I wanted to look at HIV and ART-related cofactors just among the CHEU group only. And in particular, I was most interested in comparing efavirenz-based regimens in utero to dolutegravir-based regimens. All right, so we found that CHEU were more likely to have a deceased or absent father, an older mother who was single or widowed, and were more likely to experience food insecurity in the household. And maternal report of IPV was quite low, or intimate partner violence was quite low, as less than 3% in both groups. But I wanted to show it here as it's relevant for the models. Okay, so this is a lot to digest, this figure, but the dots in these forest plots represent differences in neurodevelopmental scores in each of the 4 domains based on the different models we ran. And in particular, the colored dots, the larger colored dots, represent the statistically significant signals we found. So we could go one by one. So at 1-year assessment, we found that CHEU and CHUU had comparable neurodevelopment scores. And if anything, CHEU actually had higher language scores than HIV-unexposed children. And in trying to figure out why this could be, my mentor, Dr. Wamalwa, suggested looking at whether they had siblings. And it is true that one potential explanation could be that CHEU in our study were significantly more likely, twice as likely, to have older siblings, which has been associated with improved language scores in other cohorts. We also found that sex assigned at birth as male was associated with poorer scores in the social and language domain compared to female. We found that preterm birth was associated with poorer gross motor scores among all children adjusting for CHEU status. Lower familial social support was associated with poorer gross motor scores. Experiencing moderate to severe food insecurity was associated with poorer social scores. And lastly, even though intimate partner violence was quite rare in this cohort, we still found very strong associations between experiencing intimate partner violence among parents and lower fine motor and gross motor scores among all children. Oops, sorry. Yeah, okay. So now to look at just the subset of CHEU children. All mothers were on ART at the time of this study, and 88% of mothers had disclosed their HIV status to their father. 88% of mothers also started ART preconception, so before this pregnancy. And on the median duration of ART was 54 months, so many of these women had been on ART for several years at this point. And 74% of our mothers were on dolutegravir-based regimens, most recently during their pregnancy. So that's the vast majority of our cohort. Okay, so again, we also found that male sex among CHEU children was associated with poorer social scores. And again, we also found that preterm birth was significantly associated with poorer gross motor scores. And among CHEU, we found that having a deceased or absent father and also related, a single or widowed mother, were associated with poorer scores across different domains. So for our main research question, which was which regimen was a mother most recently on during pregnancy, we found that if a child was exposed to efavirenz-based regimens most recently, they had significantly poorer gross motor scores than had they been on dolutegravir-based regimens. And as many of you know in the room, mothers change ART regimens throughout their pregnancy, and there's quite a bit of heterogeneity. And to account for this, we ran multiple sensitivity analyses. One of them being we compared only mothers who were only on efavirenz exclusively throughout pregnancy and mothers who were exclusively on dolutegravir-based regimens throughout their pregnancy. And still, this association persists. So children who were on dolutegravir had better gross motor scores at 1 year. So in conclusion, biologic and social factors were associated with child neurodevelopment. And despite several sociodemographic differences between our CHEU children and our CHUU children, we found that 1 year neurodevelopment was still similar. And healthy neurodevelopment is a shared endpoint for all children. And so we believe that addressing household factors such as relationship dissolution between parents, food insecurity, and intimate partner violence may provide strong benefits for mothers and children, regardless of maternal HIV status. We found that dolutegravir use was associated with improved gross motor scores, And potentially, this might be partially contributing to the lack of difference we observe between CHEU and CHUU, but this has yet to be explored further. And so for my postdoc, we are launching mixed methods sub-studies within the HOPE study, as well as Dr. Kathleen Powis's FLORIS study in Botswana. And in these two studies, we'll be embedding qualitative and focus group, qualitative and photo voice research to look at family dynamics and caregiving practices and how this might impact child neurodevelopment, so we can hopefully come up with some interventions. And I want to thank our study participants first and foremost, and my incredible mentors at the University of Washington and Kenyatta, especially Dr. Grace John Stewart. Please contact me if you have any questions, and I'm really grateful to be here with all of you. Thank you.